In this video, we'll discuss about recurrent Apthous ulcers, which is a very commonly asked question and is very common condition seen on daily basis. So let's start with the definition. It is basically a common disease characterized by development of painful, recurring, solitary, or multiple ulceration of oral mucosa. Now you must remember all these keywords. To remember all of them, just go by prism without an eye, and you can remember painful, recurring, solitary, and multiple. So now coming on to the other name, it is also called as canker sores. Now let's talk about the classification. In classification, we divide them into four categories. One is the recurrent Apthous minor, then recurrent Apthous major, then recurrent herpetiformis ulceration, and Bassett syndrome associated. So in this one, it is the most common. What you will see is, suppose this is the lip. This will be like small dots. This will be the bigger one, the big ulcer. And this will be very small, and they'll later on call sick, which we'll discuss in the clinical features. They could be 100 in number. All right. Now, this is basically the most common one, the minor one, and this is the most severe form. Earlier, it was called as Sutton's disease. All right. Now let's talk about the epidemiology. It occurs more in females. Also, 50 to 20% of the population has had it in once in their lifetime. It usually occurs in adults and early childhood and teens. Also, it occurs in adults who have history of anemia, smoking. So this is the epidemiology. Now let's talk about the etiology. What causes the ulcers? So the first one being the bacterial infection, Streptococcus sanguis, also infection, so HSV. Then it can occur because of the genetics. Also immunological abnormalities, stress, trauma, systemic conditions, iron, vitamin B12 deficiency. Also because of the psychic factors we have discussed in the stress, allergic factors. Now after this, we'll talk about how the disease actually proceeds. So progression. So basically, first the ulcer, it will start as a round and oval area. Then a wide pinpoint ulceration is started. Pinpoint central areas of wide ulceration. Next, 3 to 7 days, the ulcer will spread laterally, becomes saucerized or cupped out. When healing commences, erythema diminishes or disappears. Small, punctuate red dot areas over ulcer bed. Now I'll tell you the clinical features in short, so that we don't have a long video because I have to cover other topics as well. So recurrent hepatitis minor. What happens is it is the most common one. What you will see is you will see around 1 to 5 ulcers. Also, you will see that it heals in 7 days and it recurs in around 2 to 3 weeks. Recurs in 2 to 3 weeks. It is painful and shallow. Now the very keyword here is criteriform ulcer. Okay. Now, in recurrent hepatitis major, what happens is it is a severe form. In this, what you will see is 1 to 10 in number only. They will be present, and we will write about criteriform as well. It is also sometimes associated with malignant ulcers like HIV. Also, a very characteristic feature is that it will be present in other parts of the body, not only in the oral cavity. Now, in a recurrent hepatitis form is ulceration. What you will see is there will be around 1 to 100 of ulcers, which will later on coalesce and form on the mucosal surface of oral cavity. They will be basically small pinhead sized erosions and they will be very painful. Also, they will recur again and again. All right, now let's talk about the histopathology, which is an important in view of oral pathology. So in histopathology, what we see is it is basically the overlying skin or the epithelium. Overlying epithelium is degenerated and ulcerated. Vacuolization and necrotic areas of individual epithelial cells. Inflammatory cell infiltrate of predominantly of neutrophils. And very characteristic is perivascular cuffing. Now perivascular cuffing is a very important feature of one more lesion, that is cherubism. Now after this, we will talk about the treatment. In also very important point, there is a one cell called as antishaw cells. Now what are these are basically cells something like this. They have an elongated nuclei and some bars of chromatid bars and elongated nuclei. Now what happens is it has basically an owl eye like appearance. These are very characteristic features that are found in, especially in recurrent hepatitis ulcers. Also, this completes the histopathology. Now, in the treatment, what we give is we give mucopain gel, amlexonox, also tetracycline mouthwashes, which are given for 5 to 7 days. Then antibiotic prophylaxis in cases of infection. Now, very important point. Sometimes it is mentioned that in severe cases we give dapsone plus thalidomide. Now, this is going to have very serious complications because we all have started that thalidomide is basically a teratogenic drug in pharmacology. So, this will lead to a condition which is phocomelia. So, it is usually avoided. So, this completes the recurrent hepatitis ulcer in a short video. I hope you understood. Thanks for watching.